I don't know if it's possible if I could ask you a few more questions about
Yes,
the
of course,
future. Is that
Doctor,
okay?
so, yeah, of course.
So, okay, this is a bit distressing, I'm sorry, but if you were in the scenario where you were at the end of life, where would you want to be? Where would you want to get care?
I think I want to be at home.
Okay.
I really, really wouldn't want to be in hospital,
Okay.
you know.
So it's useful for me to know that, because that's something that we can plan for in your care plan, which we can put together.
Okay.
So that's useful information, so thank you. You've mentioned about hospital, and you've said that you didn't like the experience. Can I ask you, I mean, it's not something you have to decide now, but if you have strong opinions either way, if you were sort of in a situation where you had a life-threatening illness, like previously when you had the chest infection or the urine infection, would you want to go back to hospital? Because if there was a potential for possibly having your life prolonged, or would you not want to go and have the maximum treatment you can at home?
Of course, you always think, oh, I want to survive, don't you really? But then, you know, if I was in the sort of situation where, I don't know, sometimes they put you to sleep, don't they? So it makes things a bit easier. Do you know what I mean? Don't want to be aware of things ending, you know.
You'd rather not be aware of the end and that type of situation?
Yeah, really, I suppose. It'd be nice to just go to sleep, really.
Okay. I mean, sometimes we do just naturally go to sleep, but other times we don't. And whether you're at home or in hospital, we can't say exactly how you would go. Are you saying that you wouldn't like people to tell you if you were going? If you were passing
away? I
away?
don't really want to know, really.
You wouldn't want to know?
No.
Okay.
No.
And would you want people to so if you were life-threateningly unwell, do you think you'd want to go back to the hospital environment, or is that something you want to think about?
Maybe I'll have a think about that. I mean, if it was really, I don't know, imminent, I suppose, and they knew that it would be no point, then of course I'll stay at home. You know.
Okay. So that's something we can look at more.
Yeah.
There are different advantages and disadvantages of going to hospital. Well, I have noticed that over the last couple of admissions to hospital, you've got weaker and less able to do things. The concern I might have about you going back into hospital is that you may or may not survive going in, and then once you were in hospital, if you did come out again, whether you'd have the quality of life you would want.
Probably not, really.
So,
And I mean, if you feel that ill, I imagine you don't really want to go on. Do you know what I mean?
I think
It's not, well, I mean, you don't want to be written off on the one hand, but then, you know, I guess we've all got to die of something,
okay.
you know.
Maybe this is something we can think about once you've had time to speak to your son.
Yeah.
There's no rush to make decisions, and you don't actually have to make a decision about it if you don't want to in advance.
No.